Hello, my name is Eric Roeder. I work in business development for Codilation. We're a team of website developers, software engineers, and just overall super nerds. We develop apps and websites in the obvious technology hub that is Fargo, North Dakota. That summary of my life sounds dreadful to most of the world, but I absolutely love my community and I love my job. Every week I meet incredible people who are absolutely inspiring. They have new business ideas or are spearheading giant projects to make our community better, or just are smarter than me and have great professional knowledge to share. I thought it would be relatively selfish to keep all of this information to myself, so I decided to start a little talk show. Welcome to my office.
Failed on this a couple times, Maddie, and this blanket, it's like getting hot in here, so I better make this work. My guest this week is Sam Chistopherson of the IFSP. The past month has been a huge transition for our world, and it's been honestly kind of tough on my mental health. So I thought I'd bring Sam on to talk about mental health tips, just how ways to get through this personally trying times, and tips to help your kiddos stay mentally healthy this week. Welcome, welcome, welcome. I'm here with my guest, Sam Chistopherson. Oh, you have changed your name since you were on the show last time, and I'm notoriously terrible at last names, so I'm glad I got that right.
You did a good, and it's a hard name to say, so good job.
Not that bad, but I'm just a trouble. So Sam, for people who didn't see you when you were on the show before, can you tell us a little bit about yourself?
Most definitely. I'm Sam. I'm the Dakota's area director for the American Foundation for Suicide Prevention, and I cover both North and South Dakota. So I'll tell you a little bit about AFSP, just because usually when I say AFSP, I get a blank stare and people go, AF what? So just a little bit about the work that we do. We're a national organization, but we're built up of a series of chapters. So it's kind of the best of both worlds. We have that national power and expertise of a national organization, but we're doing things locally on the local level. So nationally, we're the #1 private funder of mental health research. We're very proud of that because the more that we know about mental health, the brain, any type of disease in general, the more resources, treatments, and tools can be created. So on the national level, we're very proud of that. On the local level, we have phenomenal volunteers across the state of North Dakota, really being empowered to get involved in their local community. So we do this in a number of different ways. We're involved in prevention education. So we train volunteers to go into their communities and give programs that focus on the warning signs and risk factors of suicide, and really talk about how we can have an honest, caring conversation if we're worried about someone or if we're worried about ourselves. We're also very active in advocacy. We help our advocates from across the state connect with their legislative leaders, really make those connections, tell their stories so they can help their legislative leaders make accurate, smart decisions when it comes to mental health legislation. We're also very active with support for loss survivors. If you've lost a loved one to suicide, you know that it's a very unique type of grief, and it's so important that you know that you are supported. Here in Fargo-Moorhead, across the state of North Dakota, and nationally, there's resources for you. So if you have lost a loved one to suicide, definitely check out afsp.org/surviving suicide loss, and there's tons of information online. And again, really, we're trying to save lives and bring hope, and that's what we do at AFSP.
Like I said, you have so much information. it's overwhelming, but it's good at the same time. So we're talking via Zoom right now because of this coronavirus. Very different, unique times. What are you kind of seeing, in our world right now with mental health because of the coronavirus?
Well, at AFSP, we encourage, we want everyone to take care of their mental health just like they would their physical health. And we always want mental health at the forefront of health. And now with everything that's kind of changing, mental health is more at the forefront, and there is more of a focus, which is which is phenomenal. So during this time, during the coronavirus outbreak, there's a lot of information out there. So when it comes to mental health, we encourage you, go back to the basics. Now is a time to focus on our mental health, put self-care in the forefront, and really use this time to really focus on resilience. So again, when it comes to physical distancing, of course, we want to take good care of ourselves. We want to physically stay away from each other, but socially, we need to connect with others now more than ever. So we need to jump on a Zoom call, a Facebook call, on the phone. We need to connect. We need that connection. And we really have a strong Fargo-Moorhead community here. So really, this is just a time to really make those connections.
And I remember, so we had a virtual coffee before this, and it just honestly, it just made my day. I'm like, oh, I just miss people and I miss Sam. Like, I just want to be in person, and this needed to happen. And that was just awesome. Do you have some like tips for us who are kind of trying to keep our mental health on? Like, what can we do, working from home or during social distancing, to like, what are some habits we can do to stay healthy?
Sure. So just I have a bunch of them, so I'll try to stay on track. But really getting back to the basics, again, all the time, no matter what, we want to focus on our mental health, and we want to focus on self-care. Taking care of ourselves is the smart thing to do. But really, now is the time to get back to the basics. Practice good sleep habits. Get some exercise, get outside, take a walk, get into nature. I know that there's kind of, we're encouraged to kind of stay at home, but that doesn't mean stay inside. So definitely just move our bodies, get connected. Eat normally, stay on a routine, that's helpful too. And there's also some really great like breathing apps you can download, or some yoga from YouTube, and really use this time to really use those strategies and take care of ourselves.
Right.
As well as, sorry.
No, I use a couple meditation apps, and those are some that help me just kind of calm down and get a little back to normal.
Yeah, and I use the Headspace app, which is, I use the free version, but I think it's really, really helpful.
Sure. I gotta look at my notes here.
I have a few other things too.
You had some more things. So yeah, let's talk about some of the habits, because like I said, you are an unlimited resource of knowledge.
You're so nice to me. You're so positive. Also, when it comes to taking care of our mental health, we also, again, we want that in our forefront. So, typically we'd encourage people to go to counseling sessions, connect with their mental health professionals, which now might be a little hard to do that, but there's been an increase across the nation when it comes to telehealth. So use telehealth, connect with your counselor, and use that technology to take care of ourselves. We also want to focus on what we can control. Reading the news, going on social media, it can be really overwhelming on times. We really just need to focus on what we can control and what we can't. So some of that involves, using this time, we have some extra time, some of those activities that we don't normally have time for, like if there's a trumpet dusty in your corner, maybe take that out, practice that.
I'm not going to learn a trumpet right
now. Well, I mean, if you had a trumpet, if you played the trumpet, you do some of those activities that you want to do, you just don't have the time for. And again, when it comes to media out there, take care of what you can control, like limit, like I'm only going to watch the news for 15 minutes, set a timer, get what you need, and then, cut off from there. And then also when it comes to controls, try to stay in your daily routine. I know a lot of us are working from home. We want to get up at a normal time. We want to shower. If we normally shower, we want to work in our living, our workspace, decorate our workspace so it feels comfortable and we're excited to be there. And really do the extra work so that we can make our environment safe, because we want to be proactive when it comes to our environment, but also make it enjoyable, because we're going to be in that space.
You're going to be here for a while, and you should enjoy it. And one thing that's kind of interesting and different is we're working from home right now, but you get to set your schedule. And that's very different. And so like I've gone back to elementary school, and I've put in gym class and recess like into my day. And so now it's like, okay, be around outside, or, and like go do some activity because, oh, it's fifth period, time to go to gym.
I
Like,
love it so much.
and sometimes I'm not going to, hi, Josh, I hope you're watching this, owner. I've scheduled in some naps.
I love now, and to take care of our mental health, getting good sleep exercise,
And
good sleep schedule is part of it.
this, and I'm just listening to you. So, one of the things that I think is kind of, it's not being overlooked, but I'd like a little bit of help with, we're aware of mental health as adults.
Mm-hmm.
A lot of my friends are parents. And so what are some things that we can kind of do to help our kids kind of get through this and be mentally healthy?
Definitely. So that there's a lot of that is, I know it can be hard because sometimes it's overwhelming, but we want to be strong and remain calm ourselves, and we want to reiterate to our kiddos or our young adults that we're in this together, we're safe, it's going to be okay. When we're talking, they're out of school too, and their schedule is disrupted, and they're kind of different too, but really let them understand that we're doing this as kind of a way to keep people safe. This is a way, kind of like a public service. We want to make sure that we're helping other people. This isn't something that we're being punished for. This is kind of the smart thing to do, and kind of talk with them so they understand the concept behind it, so they're reassured that it's going to be okay. And again, we're in this together as a family. It's going to be all right. And then just reassure them again, those routines, taking care of themselves. And also, adults, we're missing that social component. Like we like to have Zoom coffee meetings, but our kiddos like to have that connection too. So if they, can meet up with their friends via Facebook or Zoom Messenger, of course you want to be there, make sure it's safe, but they need that connection. That connection too. It's really just listening to them and having conversations with them. And if they're concerned or they're afraid, just, say it's okay, and that you're listening to them, and have a conversation so that they feel supported. And then of course, again, if your child, sees a mental health professional, really check into those telehealth times. Like we definitely want to make sure that they stay in those healthy practices for those treatment plans. We want to make sure that they're getting that as well.
Kyle, you are just my mental health resource. And I again, you're just so much information.
You're so nice.
If that wasn't enough, and like I said, we'll get your email if someone wanted to reach out to you at the beginning of the show. But do you have any other resources if people had questions or concerns that you would recommend?
Yeah, definitely. A few items, just again to, restate what I already said. This is a time to, practice that physical distancing. But again, I sound like a broken record, but we need to connect with each other now more than ever. So, use those Zoom chats, FaceTime our family, our loved ones, make sure that we're supporting each other. There's tons of information out there. I know for me, sometimes it's overwhelming because there's a lot of, I read the news in the morning, but then I read it at night, and there's, different information, and then I open Facebook, and then so it's just kind of overwhelming. So I encourage you, if you go to afsp.org/COVID-19, there's an updated toolkit that all focuses around mental health during this uncertain time. So it's really nice because, all of that information out there is really overwhelming, but everything in this toolkit is ways that we can promote our mental health, take care of ourselves during this time. There's reading guides, helpful tips. So there's an article that I love sharing that has been really helpful with my volunteers, which includes like how to take care of our older adults' mental health during this time, and that's really important. How to take care of our mental health during this time when there's kind of uncertainty, as well as there's also ways that you can connect with your local IFSP chapter, talking about virtual programs. And then there's also at least for me, when I go on, Facebook, it can be really overwhelming with all the negativity. There's also a box on this toolkit that you can download, social shareables, and it's really like hopeful messages talking about, we need to water our mental health garden, or focus on positivity, and those are just some really nice things that you can share. So again, there's a lot of information out there. I encourage you to focus on your mental health, afsp.org/COVID-19, as well as if you're seeing a therapist or counselor, make sure you continue those appointments through telehealth. It's so important that we stay connected. And then always, as a reminder, someone is always available, no matter what day it is, no matter what time it is. Always call the National Suicide Prevention Lifeline. Again, no matter what time of day it is, no matter what day it is, someone is always available. In North Dakota, we're very lucky that they're answered locally here by FirstLink. So that's the National Suicide Prevention Lifeline, which is 1-800-273-TALK, which is 8255. Or you can text TALK to 741-741. And again, no matter what time it is, someone's always available.
And I'll have Maddie, my delightful intern, put all the website up. I'll have everything in the description, and then those phone numbers, because again, this is an important issue that is there's a lot of weird ripple effects, I think, with COVID-19, and I want to help as many people I can and be positive and try to stay positive in all of this. And so even though we're on Zoom and we're not in this virus cannot destroy the entire format of my show, so I think we need a nerd question.
This is my favorite part. I love this.
The nerd question for you is what is the nerdiest thing that you've reintroduced yourself to during social distancing?
Well, I don't think it's nerdy at all, but I tell all my friends and my family, and they're like, oh. But I try, because I try to keep busy. It makes me feel better. So I was listening to a weird amount of TED Talks, which from all different, subjects and things. And I was focusing on one thing, and then I got off over here anyway. But somehow I got in on the lines of we need to start composting because it helps the world on every level. So I was learning about how if you throw an apple peel away just in the garbage, in my mind I thought oh, that it'll be go back into the ground, it'll be but no, I didn't know that there's a scientific process behind it, and you have to help the soil so I'm composting now, and I'm very excited about it. And my husband just gets grossed out because I've been keeping all the banana peels in this bag in our fridge, but it's going to save the world, and I'm very excited about that. So composting.
Composting. I have been listening to the Harry Potter books on audio.
I do that all the time anyway.
Yeah, holy cow. I did some research, and books, I didn't do the first 3, but books 4 through 7 are still delightful. so
I cry in 4 every time. I mean, I've read it multiple times, and every time waterworks.
Oh, I cried at the end of. Yeah, I cried enough. it was a weird couple. What are you doing on Saturday? I'm just reading, listening to Harry Potter and crying. That's normal.
But it's good for the soul. I mean, truly.
It's good to make emotional connections with these. That's a good book if you're crying at the end. Oh, I don't even want to talk about it because I don't want to get emotional.
I should have said that in my nerd response, except I do that no matter what. I'm always, if it's in my car, I'm always playing some audiobook.
That's not out of your routine. I reintroduced myself to The Sims too.
Oh, I have not played that. I heard that's nice.
The Sims is fun, and I can go party with my neighbor, and it's socially acceptable. And so
yes.
Yes. That's like I said, I've been doing all sorts of weird. I'm not bad at hiding in a corner and playing video games.
That's wonderful.
Yeah. So Sam, did you have any final things on mental health or anything else to add?
Just as a reminder, now is a time to take care of ourselves, now more than ever. Check out the website, get some updates on how you can, again, take care of our mental health, give ourselves some grace, focus on resilience, and we really will get through this as a community.
I agree. And so, yeah, stay positive. And thanks for being here, Sam, virtually, and just even always being there for me, not virtually. So,
Thank you so much for having me on today.
all right. Have a good weekend, everybody. Okay. So now.
I don't know what I said because I got so nervous that I was just like
Yeah,
rolling out. Was that helpful?